When I was doing trauma surgery in South Africa, I saw necrotizing fasciitis or flesh-eating disease for the very first time in my career. So a young man was admitted to the trauma ward after he had intractable pain that was radiating up his leg after he had stepped on broken glass or a nail with his bare foot. And he developed golf ball-sized blisters that developed around his ankles and lower calf with fever and unstable vital signs despite being treated with IV antibiotics. So we took him to the operating theater and I had scrubbed in with my attending, and I distinctly remember seeing my attending make an incision in the skin in his lower calf and there being kind of dark purple tinged muscle that bulged out, and he took his finger to hook the muscle and I saw his finger run through the muscle almost as if it looked like dark purple jello. And so the attending continued making incisions higher and higher on the leg until we reached the mid-thigh, and that's where the muscles looked bright red and healthy. And he instructed me to take a Geely saw, which is kind of like a chainsaw that you operate with your hand, and to saw the bone off 4 to 6 inches above where the muscles looked healthy. So the way that it works is you run the chain back and forth around the bone and it creates friction and cuts through the bone. And so we amputated his leg, we put a sterile dressing on and admitted him to the trauma ward and continued treating him with broad spectrum antibiotics. And as he stabilized, his leg was eventually closed with skin. And about 10 days later, he was up on the ward learning how to walk with crutches. And I would imagine that to this day, he probably still uses crutches because he probably wasn't able to afford a prosthetic leg. And I've only seen 2 other cases of necrotizing fasciitis in my career as a doctor in Canada because it's so incredibly rare. And despite having such powerful broad spectrum antibiotics in our armory, amputating a limb is usually necessary to save the life.